This is a very dysfunctional area in the body. If you can treat it effectively, it's going to make a big difference in your overall cervical function. So same thing, I like treating any of this cervical area that we can in the chair. It allows things to be a lot more relaxed. Big step, always bring that arm over, lets things relax. That's going to open it up. Going to help the client through the motion. This one we want to get a little more extension than we even did down low. That's going to really help this slacken and open up. And then essentially the client is just going to go straight back down into flexion. That's going to be the motion. You want to make sure they have that down in the motion, because if they go too quick or they don't move it effectively, you're not going to be able to get proper depth and tension on there. So we've gone through the palpation of that, but let's just have a review here. So we find that superior angle and we find that C7. And a trick that I like to do is as I bring it back, you'll see this crease of the neck. As you open that up, that's where it's going to start. So now I'm going to be able to actually go in there in the crease of the neck. It's like a cheat. And then basically our tension is going to go right down here, and where it gets dysfunctional is right in through here. So now that we found that area, we're going to be here. So now that we found that area, as we talk about in the warm-up, it kind of goes all together. You want to be at this 45-degree angle. When we're doing the CT erectors, you've been more here. This one, we're going to come straight in just like this at a 45-degree angle. We found it with that extension. That allows us to go right here. We're going to approach just like this, and then we're going to back that thumb up just like we've been doing all along with that thumb backed up. And as we practice, our elbows are here, and remember we go up on our toes, and that's what allows us to get our depth. I'll get a little extra push with this other arm in there like that. I'm going to back out a little bit, and then my tension is going to be a pull back with my lats, and my butt is going to drop, just like we practice every day. Once that's loaded, the client goes through that motion, and I'm not sliding, I'm letting it come to me. And you got to be careful here to not be too compressive, because it really is superficial, and if you're too compressive, it's going to trap. So continue to have the good mechanics like we talk about every day to set them up. They all come together. So in here, and your setup is key each time, because if you don't set up properly, you're not going to get an effective treatment. So this is where you have to go slow in order to go fast. So we're in just like that at that 45-degree angle. We're going to come straight up. We're going to slowly drop in, get a little more depth here. We're going to back out, and then we're going to set our tension by dropping our butt and pulling our lats. And as that goes through, go ahead. Go nice and slow, and this is going to be bad on anybody that has a neck problem. So the key is always in that setup. As we talk about when you're doing those warm-ups, you want to make sure if you're treating in the cervical thoracic area and you're treating down here, you're going to be here. But with this levator, it's kind of got a little bit of a laterality component to it. So your setup is key. So you set everything up just like that. The client knows exactly how to run through that motion. You're going to bring that extension back, and you're going to see I approach it at that 45-degree angle, just like we do in the warm-up. And essentially what I'm going to be able to do is I'm nice and relaxed here. I'm not compressive yet. I'm just letting things be nice and relaxed. I'm going to go up on those toes, and then I'm going to drop straight down. That's going to help me get some of that depth. I'm going to take this opposite hand that's backing it up, push in a little bit more. I'm going to back out just a bit, and then I'm going to drop with my butt and my body and pull with my lats, and the client's going to go through that motion nice and slow. And let it come to you. There's no slide.